first, we're going to do the auscultation of the heart sounds. I'm going to find her S1. First off, we'll do the tricuspid valve, which is the fourth and intercostal space at the left sternal border. So I'm going to her xiphoid process. And I'm just going to go a little bit laterally. I'm going to twist my bell here. And then, Kristen, can I have you breathe in for me and breathe out? Okay, do it again. Breathe in. S1, we're going to do the mitral valve, which is going to be at the fifth intercostal space. Again, xiphoid process. And then I go laterally and the middle of the mid-clavicular line. Same thing with my bell for this small part. Into it, okay? So can I have you breathe in for me? Okay, and then breathe out. Breathe in for me. And breathe out. So next we're gonna do the pulmonic valve, which is the left second intercostal space. Okay, yeah. So I'm gonna go from the sternal notch, and then I'm gonna go down to the angle of Louis, which should be like here, if you feel that divot. And then angle Louis is in line with your second rib, so I'm gonna go laterally. And then going down inferiorly till I feel that space is gonna be the second intercostal space. Okay, so I can breathe in. Breathe out. Okay, breathe in. And then breathe out. So we're gonna do S2, which is her aortic valve. So it's gonna be right of the intercostal space. So what I'm gonna do is find the sternal notch right here and go down, palpate down until I find the angle of Louis, which is right here. So then angle of Louis is in line with her second rib. So I'm gonna palpate towards laterally. So I'm gonna find her rib, and then probably the space underneath it is gonna be the second intercostal space. Okay. Breathe out. Breathe in. Breathe out. Okay. Important to note is that I'm using the big bell for this side, for this S1 sound, S2 actually. So we're gonna do auscultation of the lung sounds. So I'm gonna start with the right upper lobe, which is the right side. So we're gonna do 1 inch below the clavicle, which is right here. Breathe out. Breathe in. Okay, breathe out. Next, I'm gonna find the right middle lobe. So I'm gonna go down inferior, which is about the 4th to 6th rib. Okay, breathe in. Next, I'm gonna go to her right lower lobe, which is from the 6th to the 10th rib. So I'm gonna go palpate on her xiphoid process, and then go a little bit medially to the middle of the to the mid-clavicular line. And breathe out. Breathe in. Breathe out. I'm gonna do her left lung. So I'm gonna start off with the left upper lobe, which is around 1 inch above the clavicle right here, and then to around the 6th rib, which is somewhere around here. You have to breathe in for me. And breathe out. Breathe in. Breathe out. Okay. Next, I'm gonna do her left lower lobe, which is from the 6th rib down to about her 10th rib, okay? So again, I'm gonna palpate her xiphoid process. I'm gonna go a little bit laterally, again with the mid-clavicular line. Breathe out. Okay, breathe in. Breathe out. Next, I'm gonna do the posterior side of her lungs. I'm gonna do the upper lobes, which is to T3 to the 4th rib. C7 is the spinous process. It's gonna be your thoracic region, okay? And then I'm gonna palpate where her ribs are. So at the end of her ribs, that's where I shouldn't go any past further than that. And then I'm gonna go from left to right, and then left to right, okay? Okay, so can you breathe in for me? Okay, breathe out. Okay, breathe in. Breathe out, good. Breathe in. Breathe out, good. Breathe in. Breathe out. Okay, breathe in. Breathe out. Okay, breathe in. Next, so we're gonna do assessment of the arterial pulses. So we're gonna first do the carotid. It's gonna be like where her sternocleidomastoid is and where the trachea is, which is right here. So somewhere between these two, we're gonna palpate for it, okay? We're gonna do the brachial, so it's going to be in the medial antecubital fossa. So I'm going this way, and then I should feel a pulse somewhere like right in where the elbow is. Next, we're gonna do the radial, so it's gonna be medial to distal radial bone. Her palm is out right here, so I'm gonna the distal part of the radial bone. I'm gonna go a little bit lower this way, and I should feel a pulse right here. I'm gonna do the PMI, which is the point of maximal impulse. So where it is going to be the 5th intercostal space and mid-clavicular line. I'm going to find her xiphoid process, palpate it. I'm going to go laterally until it's the middle of her clavicle. I'm going to go one up since the xiphoid process is in line with the 6th rib, okay? And then I should feel a pulse right under your knee. I'm going to do the femoral, which is the midway between ASIS and the pubic symphysis. Palpate her ASIS, which I go from the crest. I go immediately until I feel that hard border. I'm gonna have my patient with the back of the palm of their hand go in the middle until they feel like a hard spot. Okay, so from between the ASIS here and then the pubic symphysis, I should feel her femoral pulsating. I'm gonna do the popliteal, and the popliteal is right behind the knee right here, in the middle of the back of her knee. And then to make her superficial, I'm gonna have her flex your knee. Can you flex for me? Okay. And then I should feel a pulse. Her dorsalis pedis it's gonna be the dorsal foot over the navicular and cuneiform. So I'm gonna find her medial malleolus. I'm gonna palpate inferiorly, and then I'm gonna go anteriorly. Okay, I'm just gonna feel that hard navicular right here. So I'm gonna go a little bit laterally, and then I know from the navicular right below it is gonna be your cuneiform, which is gonna be hard to palpate, but somewhere between these two structures, you're gonna feel like a pulse. Okay, and this is for the dorsalis pedis. So next I'm gonna do is the posterior tibial. And what I'm going to do is like palpate for your medial malleolus, and posterior to it, there's going to be a pulse feeling right here. I'm going to do a test for the medium sternum shift. So I'm going to find her sternum notch right here. And then breathe out. Okay, breathe in. Breathe out. Okay, good. And what's nice is that I didn't feel her trachea shifting left or right. So that means she's pretty good. Assessment of the chest wall motion and diaphragmatic breathing. So first, up for the chest wall motion, we're going to do the upper lobe. So my hands are right under her clavicles. So when she breathes in, the distance between the thumbs should be apart. And when she breathes out, the thumbs should go back in. Okay, so can you breathe in? Okay, breathe out, good. Breathe in. Breathe out. Do the middle lobe for chest wall motion. Where my hands are should be right above the xiphoid process. Same thing, when she breathes in, the distance between my thumbs should go out, and then when she exhales, my thumbs should be coming back in, okay? Okay, breathe out, good. Breathe in, and breathe out. Do her lower lobes, and what I'm gonna do is that I'm gonna palpate for the inferior angle of her scabs. I'm gonna bring my thumbs together, and then can you breathe in for me? Okay, and breathe out. Breathe in. Breathe out. Okay, next I'm gonna do her xiphoid process. So my thumbs are right above it. When she inhales, you can see the space between my thumbs getting bigger. And when she exhales, the distance of the thumbs getting smaller.